Good afternoon and welcome to the second of 4 webinars as part of the What Works Festival of Learning. The series, as many of you will know by now, is all about sharing knowledge and ideas, discussing best practices in the areas of prevention and early intervention, while keeping us all as professionals curious about how we do better in terms of our work with children and families. What Works is an initiative designed by the Department of Children, Equality, Disability, Integration and Youth, and it's funded through dormant accounts. Now, as many of you will know from tuning in on Monday, the theme for this year's festival is Fairer Futures. And on Monday, we had a stellar panel that was kicked off by Kate Pickett, co-author of The Spirit Level. And for any of you tuning in today who may have missed that first webinar in the series, you can go back now and watch it on whatworks.gov.ie/Festival of Learning 2021. I promise it really is worth your time given the stellar contributions and audience questions that we had on Monday. Today our theme is going to be all about mitigating disadvantage through public policy. If you're joining us on Monday next, the question we're going to ask is making connections or digitally divided disadvantage in the digital world. And on Wednesday next, the question will be, how can the EU prioritise the needs of children and young people? And you can still sign up for those sessions on the What Works website. As we mentioned, today we're going to talk a lot about public policy and ask questions like, how can public policy mitigate disadvantage? What's being done in other countries? How are policymakers in Ireland working to support disadvantaged families as the pandemic continues? We're going to hear the balcony view of all of those questions from Olivier Thévenon, who comes from the OECD Centre for Wellbeing, Inclusion, Sustainability and Equal Opportunity. He'll be joined shortly then by our incredible panel of speakers from the Department of Children, Equality, Disability, Integration and Youth. We have 2 policy makers, Conor Rowley, Assistant Secretary, and Ciara Pigeon, Principal Officer. We'll also be joined by Conor O'Mahony, Special Rapporteur on Child Protection, and Karen Kiernan, CEO of One Family. We're also joined here again today by Irish Sign Language interpreter Bernadette Ferguson. Now, over the course of this next hour, we hope our speakers will be able to share with you, our audience, some of the ways that policymakers are working to address inequality and disadvantage in Ireland, provide some new thinking from other jurisdictions and of the perspectives outside of government. And we really hope, like Monday, we're going to be able to bring you on a journey of really diagnosing the problems, trying to understand what some supports and initiatives are already in place, but then bringing you to a sense of what more can be done. What are some of the other ideas, solutions that we can gravitate towards? Just like the first session, we would love your questions throughout the next hour. You can do that by going to the right-hand corner of your screen, hitting on that little speech bubble, get your questions in there. What we'd ask you to do is try and keep your questions short. We want loads of them. We'll get through as many of them as possible. If there's a particular speaker you'd like to direct your question to, do just call them out by their first name. Try and keep the question short, as we say. We'd also love to have you on social media talking about the contributions, insights, takeaways that you're going to hear today using the hashtag Fairer Futures across all social media platforms. Now, to get us started, we'd love to start with a poll. Simply to understand your own background, a little bit of an insight as to what might bring you here today. I think it'll help our speakers really understand who they're speaking to, and they can really consider and address their remarks. So the question that you're going to see when you go down now to the little poll icon, again, it's down there beside the speech bubble, the right-hand corner of your screen, just hitting that little poll icon, you're going to see a question pop up that says, how does your own work interact with public policy? And you're going to see a number of answers provided there. So the first might be service provider. So you're somebody who's implementing public policy. Maybe you're from the world of research and academia. So you're constantly thinking, writing about this whole area of public policy. Maybe you're a policy maker. So you're maybe working in a government department or a state agency. You might be someone who's a practitioner, so you're out on the front lines of our support services. Or you might be from an NGO or advocacy organisation, so really working to inform and influence policy. Or you can tick just other, just somebody who's interested in this whole area and you decided to spend your lunchtime with us today. So as I say, head down to that little poll icon in the bottom right-hand corner of your screen. in order to see that question of how your work interacts or how all of this describes you best. And we're just going to monitor here quickly for poll results. So we're seeing, lots of people who call themselves service providers, lots joining us from research academia, policymakers, NGOs, advocacy organisations, and a few of you seem to be here just because you're interested in the subject. So whoever you are and wherever you're joining us from today, we're really delighted to have you. And as I say, as you hear all of the remarks and contributions for the next hour, do just that speech bubble beside where you found the poll, do just come in with your questions throughout and we'll be filtering them as we go. Now, to get us started, I'm delighted to be joined by Olivier Thévenon, Head of the Children's Wellbeing Unit at the OECD Centre for Wellbeing, Inclusion, Sustainability and Equal Opportunity. His recent work focuses on child wellbeing measurement and policies, family and child poverty and services for families. We're particularly interested as a theme today throughout the conversation in a recent report Olivier co-authored, which was called Looking Beyond COVID-19, Strengthening Family Support Services. Olivier, you're so welcome. It is great to have you here. For the What Works Festival of Learning. Maybe to kickstart, Olivier, you might bring us back just to the simple question of why. Why this whole work of family support services is so important, why it needs to be prioritised in our countries by our policymakers in society today.
Thank you, Honia. And first of all, let me thank the organizer for having this discussion on a very important topic. Let me start by taking a step back and providing some background to understand better why it is so important to develop policies to support families. The first thing that should be reminded is that there is a wealth of evidence showing that childhood experiences are important determinants of later health, education, or labor market outcomes, and that investing in child and family services is key to combat child poverty to ensure that children start life on equal footing. Just to give you a few numbers, not too many, but just a few to have some background. So you know that child poverty is one of the big issues that impedes many children from enjoying a secure and happy childhood. In Ireland, children make up 1/4 of those living in income poverty, despite they represent only around 8% of the population. So child poverty, their likelihood to be poor is much higher than the rest of the population. The other evidence that we have is that addressing poverty and adversity in childhood make strong economic sense. There are not many evaluation of how much does child poverty cost to a country, but there are a few. For instance, in the United States, that shows that child poverty costs around 2.5% of their GDP. If you add the cost that is also associated with child maltreatment, with crime or incarceration of young adolescents, these numbers can increase up to 5% of GDP. So there is some economic case to invest in combating child poverty and in investing in family support services. Then, when you compare Irish situation to other countries, when it comes to how much countries spend to support families, you inevitably observe that spending on services for families with children in Ireland is comparatively low. On average, Ireland spend around 1.6% of their GDP on families, while it is more around 2.3% on average in the OECD. When you try to figure out how much is spent on services, including education and care services and family support services. The amount is around 0.3% of GDP spent on services in Ireland, while it is 3 times higher on average in the OECD, and it's even 2%, for instance, in countries like Denmark or Sweden. So spending on services for families is much lower in Ireland than it is in other countries. Of course, the widespread closure of childcare services during the pandemic has shown how important are education and care facilities for families. Affordability of these services remains a big issue in Ireland, especially when we compare to other countries, especially for two-earners families with low income. And there is also a big gap in attendance of education care services by socioeconomic status, gap between low and high income families. So it remains a kind of privilege for wealthier families. So it's very important for countries to invest in childcare services because it's key for enabling parents to combine work and family, to raise family income, and therefore to combat child poverty. However, it's not enough. It's needed to invest in childcare services, but it's not enough to respond to the multiple challenges faced by disadvantaged children.
So to that end, Olivier, in terms of that question of, well, what would be enough or what more, particularly with COVID over the last 19 months, like what are maybe some of the challenges that policymakers across the OECD countries have been thinking about and designing for? And I know something in your research that you're thinking a lot about is making sure that you're matching the right services and supports to the right milestones, the right moments in children's lives, you know, from pregnancy right through the first 1,000 days in a child's life, whether then it's in school and making sure that you're having school meals program, but very much matching the milestone moments, the age, to the right services and supports.
Exactly. It's key to ensure that families have access to services that are appropriate to the age of children, and that there is a continuity of support services throughout childhood. So in general, so what has highlighted also the COVID crisis is that the countries have to provide multiple family support services to mitigate the impact of the pandemic on families of children on multiple domains of their well-being. So usually there is a wide range of services that are provided. Some are targeted to mitigate the economic impact of the pandemic. We observe that there is increased poverty, increased intensity of poverty. So more families have more difficulties to meet ends. There has been increased take-up of food assistance, so it's very important to provide this basic assistance to families. But what also the pandemic has highlighted is that policy measures such as school closure, lockdowns, teleworking from home has also put considerable stress on families. And it has raised many issues for children, including increased rate of anxiety, sleeping disorders, other mental health issues. So to support families, families need to receive assistance in all these areas. And of course, the pandemic has also showed the importance of these services, but it has challenged the capacity of the service delivery system. First, to reach the most vulnerable families quickly. And in that regard, digital tools have been quite useful to reach quickly and to identify the people at risk, families at risk. The other key issue is to respond to families and children with complex and intersecting needs. So it remains a big challenge for countries. Because the matching the family services with families' needs requires close coordination between various organizations delivering services. And there are multiple ways to provide this coordination, but it all requires case management to treat family as one whole unit and to consider the needs of all family members through approach that may vary.
Great. Thanks, Olivier. Maybe just one final question before we broaden this out to our other speakers. I think you've really eloquently demonstrated, the why all of this is so important, the impacts on our children and our young people, particularly over the last 19 months, and how we have, as you say, then to match the services supports to the age-appropriate moments. Bring us a little bit now to, how policymakers maybe can make sure they're meeting the needs then of our most disadvantaged, vulnerable children in society when it comes to joined-up policy, when it comes to this interagency approach, when we think about better digital tools that we have needed and will need more of in this moment of a global pandemic?
Well, the first thing to say is that since the multiple problems, issues have to be addressed at the same time, and these are issues that parents face, but also children face, and there is a need to consider jointly the issues faced by the different generations living in the same household, so parents and children. So, and there is a growing number of service providers that are taking what is so-called the two-generation approach, which try to consider simultaneously the needs of parents and children, and try to provide at the same time the support for children, the assistance they need to develop well, but also assistant parent needs to improve their language, or to access employment, or to access training, and be able to be back in the workforce at the same time as they provide good care for their children. So this needs more coordination between service providers, and this needs good coordination mechanisms to share governance responsibilities for family support services. Many countries have been very creative during the pandemic to create or to foster coordination between service provision while there was many disruption in the service system. For instance, in New Zealand, they have established a network networks of service providers, where CEO of service providers met on a regular basis each week to better allocate the supply of services to the families in need. At the government level, interministerial bodies or committees have been created, for instance, in Norway or in other countries, so to foster collaboration across administration. Joint-up policy is needed at the governmental level. It can be also developed further by mechanisms like child budgeting, like child impact assessment, or whole of government approach to child and family support services making. So that these are key elements at the government level to better coordinate the provision of services.
I know this theme of the interagency, the collaboration, the cooperation is something we will definitely return to between now and 3 o'clock. But Olivier, thank you for those opening remarks and framing it up for us on the balcony, giving us that European-wide perspective. And we will come back to you shortly. We already have questions coming in from the audience. Just a reminder to anybody who wants to ask a question, head down to the right-hand corner of your screen, hit on the little speech bubble, direct your question in there. I'm going to go now more broadly to our panel just to get their initial reaction to Olivier's remarks there, and then we'll broaden the discussion. We're joined now by Conor Rowley, who is Assistant Secretary at the Department of Children, Equality, Disability, Integration and Youth, with responsibility over the Child Policy and TUSLA Governance Division. You'll also see on your screen shortly Ciara Pigeon, who is a Principal Officer at the department, the same as Conor, where she leads the department's work in the Parenting Support Policy Unit. We also have Professor Conor O'Mahony, who is Special Rapporteur on Child Protection in Ireland, appointed in 2019 by the government for a 3-year term. Conor is a Professor of Law at UCC, and his research includes constitutional law and child law, with a particular focus on family and children's rights. He's also the Director of the Child Law Clinic at UCC. And finally, Karen Kiernan is CEO at One Family, and One Family is Ireland's national organisation for one-parent families. The organisation works with one-parent families to effect positive change and achieve equality and social inclusion for all one-parent families in Ireland. Conor, to come to you first, you heard kind of that European-wide perspective there from Olivier, and there was some interesting Irish statistics that he mentioned that I wouldn't mind if you could pick up on them there in terms of our GDP spend, 1.62% compared to the 2.34%, but also those themes of the interagency, the collaboration. Could you maybe pick up there and anything else that particularly resonated in an Irish context?
I will, Anya. Thank you, and thanks, Olivia, for that really insightful presentation. Just a few points. I think the anchor point or point of departure for Olivia was saying it makes economic sense to advance this. Fully agree, it makes economic sense, but it makes also huge sense in terms of outcomes for human and social services, and also there's an economic, a moral argument in terms of addressing these issues. So really timely that we are looking at this. The expenditure that you mentioned is something that's interesting. I'm not familiar with the source of Olivier's citation there, but it's something that we have tried to look at before, and I think we will need to revisit again, about trying to estimate the cost of services, but also supports, that's critical as well, around cash transfers, income supports that go to children and families. An attempt was made in recent years. I think we're going to have to revisit that because it requires a far more sophisticated approach in terms of trying to disentangle where those targeted supports go across the range of government departments. So that's something I think we should look at, and perhaps in the successor strategy for better outcomes, brighter futures, it's something perhaps we could revisit and look at. But I think it's really interesting. It does provide a good benchmark, and it does give comparability with other jurisdictions as well. So I think that is a very useful point that has been made. I like the phrase that you used, Anya, in terms of matching service with milestones, and I think that's critical. I think we need to be far clearer around delineating and distinguishing what services are there on the continuum of supports for children in response to the continuum of needs that they have in terms of learning development, and more so also in terms of more crisis and sharp interventions. So I think that's critical. But also on that, I think we need to kind of interrogate the fact that the existence of services does not necessarily translate into access into those services or quality of those services. So that's something we really need to look at in terms of services that have a significant waiting list for children and young people, and that's causing difficulties for them. So that's a key piece as well. And I think in terms of looking at that, because when you go back to the EU investment in children package and that policy programme, it was a multidimensional approach. It looked at cash transfers, income supports. It looked at participation, access to services, voice of the child, but critically it looked at quality of services, and that's something that we really need to look at in terms of service impact, service reach and service responsiveness. And I mean that across the sector, statutory, community and voluntary. So critically that we see ourselves as part of that system. And then finally, just to say, during the early stages of COVID, we did launch a Supporting Children information campaign that was relaunched and rebranded now as Supporting Children and Parents. That was a really interesting piece because for the first time we brought together all the supports and structures in place for children and young people. We demonstrated how integrated they were, but critically in that, Anya, what we did was we listed the step up actions that all services, community, voluntary and statutory, were doing in response to the needs of children and young people during COVID, and the innovations that came about. And the accelerated progress in that across the system was really impressive. So the challenge for us now is to build on the learning from that, but also enhance the momentum from that and ensure we don't lose any of those innovations and we can catalyse them going forward.
Great. Okay, loads there that hopefully we can tease out with the rest of our panellists. Maybe, Ciara, to bring you in, so you're working a lot in terms of parenting supports. One thing I know Olivier has covered off a lot in his research is just sometimes the question of why families may not actually take advantage of the services that are provided to them. And Olivier has talked about in his research lack of information and awareness. Sometimes there could be financial issues or physical mobility that means that they can actually access the services, but sometimes also just social cultural barriers, just maybe sometimes a feeling of being stigmatized. So could you maybe just talk in a broad sense of where parenting support services fits in terms of everything Olivier has talked about today?
Thanks, Anya. I was struck by a number of points Olivier made there, and also previous work by the OECD. We've been had a lot of engagement with parents as we develop a national model of parenting support services. And one of the strong messages we got from parents themselves was the lack of awareness of available services. And, I think it's really striking when a parent says, I found out about a service, but I needed it 2 years ago. So it's really crucial that we raise awareness of the services that are available. I think also raise expectations about what services can offer, because we do have many excellent services with proven benefits for children and their families. And I think, it's important that people know the value of them. But then also there's the question of availability. So whether that's, the ability to meet the demand for existing services, where we know the demand is stronger than the supply, but also the areas of the country that may not, where parents may not have access to particular services. So filling gaps is really important too.
Okay, that's great. Ciara, we'll come back to you for more, but yeah, that point is so well taken about the raising expectations, but the lack of awareness, and hopefully that'll be something we can pick up with others shortly. Conor O'Mahony, to bring you in, you've been looking particularly at the last 19 months, a lot of the data that is really starting to tell a story of the impact of the last 19 months on our children and young people when it comes, the consequences of our homeschooling, that digital divide, the lost school days, even the junior cert changing, right up to really trying to understand the communities that have been most impacted, whether it's children, young people in direct provision centres, traveller community, etc., etc. Can you kind of paint us a picture, when you hear Olivier there at that European-wide level, paint us a picture of what particularly the last 19 months have looked like here in Ireland?
Yeah, so the picture in Ireland during the COVID crisis really has been broadly in line with the experience in other countries. We haven't been much of an exception in that regard. And the general trend, is captured very well. There was a poem that was published at one point during the height of the pandemic, which people may have heard this phrase about the fact that we are all in the same storm, but we are in different boats. And that's very much been the experience. So everybody was affected to some extent. All families felt the impact of COVID. But the extent to which that impact really landed on families did vary very much depending on how disadvantaged they were to begin with. And the worst impacts of COVID have been disproportionately felt by families from marginalised or disadvantaged backgrounds. And we see that across a whole range of different headings. So to mention a little bit of the data specific to Ireland on that, if we look at the economic impact, for example, and we look at poverty, so there was research done by Red C, for example, on behalf of St. Vincent de Paul. And what that showed was that families who were financially comfortable before the pandemic, about 21% of those families began to feel financial strain because of the pandemic, whereas 85% of families who were already struggling before the pandemic found themselves struggling even more as a result of the pandemic. So that's just one very concrete example of that disproportionate impact. You alluded there, Anya, to the digital divide. So homeschooling, again, was difficult for everyone, absolutely everyone. But if you were a child living in direct provision who didn't have access to a study space, who didn't have access to reliable Wi-Fi or technology, or so on across different marginalised communities, again, your ability to engage with homeschooling was considerably worse than children perhaps who had access to all of the technology and infrastructure issues that were needed to allow you to continue with that. Again, on play and leisure, similar impacts, that children who were living in accommodation where they didn't have access to safe play spaces would have been more affected by the closure of playgrounds, the closure of sports clubs and other out-of-school activities and things of that nature. And then as we go through into, I guess, some of the more serious impacts, a really, really big one is mental health. So there's so much research documenting the really, really dramatic impact of the whole COVID crisis on the mental health of young people. So in Ireland, in the youth sector, the statistics show that there was about a 70% drop in engagement with youth workers. So again, that would be disproportionately impacting on a lot of children from marginalised backgrounds. Youth workers who were surveyed, 82% of the respondents in one survey predicted long-term damage to the young people they were working with. And the waiting lists for child and adolescent mental health, which were already much too long before COVID, increased by 20%. And so again, you're going to see that really starting to bite in some of the more difficult cases, children with the most serious needs. When you look at evidence that we get from bodies like the National Review Panel who look into cases of deaths in children in care and so on, you see in those reports a lot of references to breakdowns in services around mental health and things of that nature. And so again, we will see more pressure coming on all of those situations as a result of COVID. So those are some examples. I mean, I don't want to hog the floor too much if you want to come in again, but we see similar statistics, and I won't give too many numbers, but increases across domestic violence, increases across things like referrals of child sex abuse material online, cyberbullying, all sorts of things that would be impacting on children's well-being. Essentially, all of it got worse during COVID.
Thanks for that, Conor. To bring you in, Karen, from One Family, everything that Conor paints a picture of there statistically, is that what you're seeing, anecdotally from your staff, from the families that you're working with out on the front line?
Absolutely. So it's completely true that the families who were having difficulty before COVID, it's just gotten worse for them. And we all know that. We know how things have gotten worse. What we saw through the cycle of the pandemic, everything was a crisis at the beginning, and then parents started to get exhausted, and then more kind of family issues started to come up, homeschooling, management of children. At the beginning was the legal, the financial issues, the access issues, the conflict. Then it became much more of an exhaustion issue. And, when I was speaking to colleagues in advance of this talk, people from the parenting service said what they're seeing now is a sense of hopelessness, actually, amongst some parents, which is really sad and really dangerous, because if you don't have hope, it's very worrying. But people are exhausted. They've had financial problems for years. They have difficulties in their families. The conflict's gone up. Aggression from children has gone up. Mental health issues, isolation, anxiety, and trauma. That's what we are dealing with, and many other organisations are dealing with day in, day out, are the trauma of people. So from an organizational point of view, our wait list, we have wait lists, which we didn't necessarily have before. The demand has been massive. We're losing staff because of the increased accommodation costs and the salary costs. So it's very challenging. And whilst in COVID, by moving to remote or to online and telephone services, we managed to work with more people who are isolated around Ireland. Actually, we also lost the ability to see some children, to physically see them, make sure they were safe. And for some people who don't have the ability to be online, we lost the ability to see them. So now we opened up our children's therapeutic services a couple of weeks ago. We're now having to withdraw them again, unfortunately, because of the COVID numbers. This could absolutely have been predicted. So these kinds of things then cause huge anxiety and stress for parents, and of course for their children, who this should be all about. So we're really concerned. We're more concerned now than perhaps we were 18 months ago. because we are seeing a tsunami of mental health issues, family breakdown, family violence, and there's less solutions. It's harder as a service provider to get into families. The courts still have backlogs. So, and it's harder everyone is exhausted, who are working in the front lines as well. So it's harder across statutory and C&B sector to keep people going.
Okay, thank you for that, Karen. And we will dive a little bit deeper now as we broaden out the question. Reminder to our audience, just hit the speech bubble down the bottom right-hand corner of your screen. Come in there with your questions, which we are already starting to see. Thank you for that. Ciara, I'd like to come back to you there. Just in terms of the picture, Olivia showing some best case examples from other jurisdictions. Conor there with some data specific to Ireland. Karen with some real case studies, examples of the impact. And I wonder from your point of view, as you're working, within the parenting support policy unit have you been able to borrow on other models, best practices from other countries across the OECD? Have you been able to move as quickly as this whole environment has changed? We had Karen there just talking about a tsunami of, let's say, mental health issues. So has it been hard to keep pace? Have you been able to iterate as you've gone along to make sure the supports and services are being tweaked and are meeting the moment?
I think for all countries, there's no easy answer to these challenges. But, one of the benefits of the work that the OECD does is it gives us, very easy access and information about what's happening in countries, across the world. And also for us, I think it's one of the real values of it is information about non-English speaking countries, because obviously, the tendency is to go with the easy option that's easily accessible. There's lots underway at the moment in Ireland, and it is very much informed by best practice elsewhere. I know when you look at the family court system and the potential there for really providing targeted supports that meet the needs of families in particular circumstances that we know have a huge impact on children. We can see examples from other countries where they have, I don't think anyone's got it right, but where they really have a good system in place that reaches most people who need the help.
Yeah, and it's, I assume, going to be finding a blend of different solutions. There's going to be no one magic solution, as you say. Keep questions coming. We have one question in, Conor, that I might address to you here in studio, which is, should governments and policy makers also apply a justice and rights lens to work in reducing child poverty and not just the economic argument?
Well, I think they do. I think all policy is grounded in that. Better Outcomes, Brighter Futures, our work on the UNCRC, so I think that's there. Are we demonstrating it sufficiently? That's another question and perhaps another challenge, but it's firmly grounded in that space. I think the economic argument is that's where we are in terms of different departments looking for sufficient resources to deliver on their mandate. So it's really important that we get the balance right with giving a compelling argument for what we're trying to do, but also that the system actually responds accordingly and delivers that. So I don't think it's just an economic argument. I think it's the child's rights, best interest of children is fundamental to the work we do in the department, and I know other colleagues around in other government departments have that in terms of the determining factor for their work.
Okay, great. To bring the other Conor back in, Conor, you've heard kind of a good landscape readout there from all your fellow panellists, and I wonder, do you feel that we understand enough yet of all of the impacts, the consequences, the new problems that we're dealing with because of this once in a century lifetime event? Do you think we have enough knowledge, data, statistics to go and make very informed decisions now, take very proactive action, as opposed to maybe a little bit more of a wait and see and we're not too sure yet? So do you think there is a moment that has to be just very much a bias to action?
I think we can certainly start the process. I think, of course, there's always scope as you go along, as you get better data and more nuance that you can finesse what you're doing. But I think we have enough information about some of the really big headline issues that are where the real demand is going to be to get that process started. And I think if we delay that, we are just storing up problems. I mean, so if you take, a couple of the examples which I've mentioned, the mental health side of things, that's very, very clear that that was already under pressure. It's now under even more pressure. So there's no reason whatsoever to delay in targeting that and trying to get out ahead of that. There's no point in 5 or 10 years from now having reports which review things that went wrong because there was a delay in resourcing that due to the impact of COVID. We know now that there will be more demand in that sector. Similarly, when it comes to things, like domestic violence, therapy and support services for families in those kind of situations. So I think we do have enough information at a headline level. Now, of course, it will be important to continue the work of researching this, gathering the best data, and it may be that there will be scope to slightly adjust as we go along. But nobody can say right now that we don't know where the big pressure points are. We do have enough information to predict those, and the earlier that we get started on trying to get out ahead of some of those issues and putting in place the measures that will meet that demand as it comes down the track, the better outcomes we're going to see for children and families.
Karen, can I ask you, where do you think some of the pressure points, the pain points are in terms of just this coordination, this collaboration that we've been talking about, this matching the right resources to the right milestones, being age appropriate, to some of the scaling efforts, being reactive in real time? Where do you think are some of the barriers, maybe obstacles that we haven't yet overcome?
From a public policy perspective, in response to that question, Anya, I think some of it is that people are overloaded and there's a lack of coordination within departments and between departments sometimes around a compelling issue. And maybe it's something that people just think will magically happen, but we know if you don't resource a structure and put a structure in place to deliver a strategy or a particular policy approach, it won't happen. And we consistently see that things fail because people aren't focused in the right way. The right people are not in the right room talking about it. So that's a big issue, and there are examples from other countries. Of Scotland in relation to child poverty, for example, does this really well. The leads of all the relevant government departments are overseen, and they have critical friends. So my equivalent in Scotland will go in and critique the child poverty delivery and implementation with a parent, perhaps, to say here's where it works, here's where it doesn't work. So there are ways of doing things, and I think this department is better than many others at collaborating with the community and voluntary sector, particularly around better outcomes, brighter futures, child poverty. I've been involved in those things myself, but there's much more that can be done to be able to work together and to try and eliminate some of those silos, because everyone is busy, but it's about doing things strategically and smart. And you just need to have the right people resourced in the right roles. And I'm not sure that bit has yet been cracked.
Ciara and Conor, maybe to bring you back in there. Ciara, maybe I'll let you go first, just on that theme there of lack of coordination. And Karen pointing to the Scottish example, I'm not sure if that's something either of you have looked at. But Ciara, any thoughts there?
I suppose in my own area of parenting support, we're very conscious of the role of other departments and agencies across government. And while there's lots of really good pieces of work and good services in place, they don't always talk to each other or share best practice or experience across the way. But at the end of the day, we're talking about the same families, we're talking about the same children. So it's really, and sometimes you come across examples where one service might have really good engagement with particular groups or, groups of parents or children or communities, whereas others have just said, oh no, that's very difficult. We haven't got a solution here. So I think there is a lot more scope for working together and addressing some of the challenges.
Conor, more scope, and just curious, that Scottish model, the critical friends, is that something that you've looked at?
Well, we have a National Advisory Council, which Karen actually is on, and they represent critical friends to our department in terms of monitoring the implementation of the policy, and they've been invaluable in terms of the expertise and perspective they bring to it. I like Karen's idea of bringing a parent in. I think that sometimes we very often forget about this. The system talks to stakeholders, stakeholders talk to the system, and very often we forget the end user, service user. So I like that idea. I think that's something that definitely has merit. Just on the broader question, Anya, I think we've no shortage of initiatives. Every department has a range of initiatives across different units, different divisions, and if you were to map them, we have a proliferation of them. I think the challenge is how these fit, how the best BET initiatives fit into an integrated response across the system. And that system, as I've said before, is not just statutory, it's community and voluntary as well, because the state fund them and they provide services on behalf of the state. So it's critical that we have an integrated, equalised approach to actually responding to it. But integration is the key. Hopefully we have the next iteration, Better Outcomes, Brighter Futures. We can ramp that up and improve it significantly. We have the implementation of the EU Child Guarantee. So it's critical that we're focusing on the mainframe services in terms of how education, health, child protection, social services can improve. And also I think we need, and this might be controversial for some, I think we need to resist the temptation of rolling out new initiatives to try and compensate for deficiencies in the system, but that would have no chance of achieving systems change, if you know what I mean. So the importance there is to look at what we have in place, look at the best practice interventions and mainframe them into the system. And that is, I suppose, the rationale for the What Works programme in terms of what we're here today doing. Yeah.
Olivier, to bring you back in, just listening to everyone since your introductory remarks, just anything that maybe strikes you in terms of the policy approach here, but I'm also curious to get your take on the quality of data. Like you heard Conor O'Mahony talk earlier about how we are better understanding, we've enough information to be proactive, if we're better understanding the mental health impact, for example, that should be built into our forecasting now. So I wonder for you, given your research, do you feel sometimes the data needs to be better so policymakers can make better decisions in the moment?
Yeah, I think we have a large range of data that shows where the needs are, but perhaps better use of data can be made at different level, at the level of the implementation and the delivery of services, and at the strategic planning level also. Let me take an example of some experience that we made, for instance, in Canada. There is. Let me take the example of the one platform which is called Health Seeker, which is an application that collects data that match data between the needs of families and service providers where the services are provided in the local area. And this is used, the app, so the service providers can connect to that, families can connect to that, and this is one mean to match the demand and the supply on a very timely and to have quick fix and to match the demand and the supply. And this was used hugely in Calgary area during the pandemic to have a very responsive and quick response to families' needs. So at the delivery level, that they collect data and they use that by developing the right applications that make users able to use it. What is interesting in that experience also is that the same kind of data is used also by local authorities to identify gaps in service supply and also to identify duplication in services, because there are gaps, but there are also duplications of services, and this is used for strategic planning in this area. So I agree that we have a lot of data. The potential is huge, but sometimes it could be better used by users, providers, and policy makers.
as opposed to the quality of it. Point well taken. Do keep your questions coming. Hit that speech bubble on the bottom right-hand corner. We have one question here. As I read it out aloud, anyone jump who'd like to take it first because it's addressed to everyone on the panel. Have the panel any thoughts on how local, place-based, intergenerational community development responses can deliberately combine parenting and family support interventions with educational, employment, enterprise supports to provide families and wider communities with pathways out of poverty, thereby linking individual outcomes to deeper systems change? I know it's a long one, but hopefully everybody is kind of getting the from to point there. Karen, go for it. Thank you.
Yeah, I mean, this has come up a wee bit actually in our discussions around child poverty, and trying to look for opportunities, say, for family resource centres or family support providers to link around employability and educational opportunities, and vice versa for Intrio or for CDTBs, to link back to family support. And I suppose in some ways it's difficult if you don't have enough services there. And I don't think we do, and I think the GDP figures, bear that out. So it can be difficult to do, but there's potential, I think, for more people. ABCs, for example, are looking now at child poverty as part of their work rather than just family support. These things all intersect, and it's about creating those local pathways and structures and skills, like right down to the staffing levels within organisations and the processes to enable those things to happen. But it's a great idea and should absolutely be followed up.
Olivier, did you want to come back in there? I see your hand.
Yes, I didn't hear you. Yes, I think this question about delivering multiple services to assist families in their multiple needs links back to the observation that Pia made, that and that Connor also made, that it's not because services are available that they are used by families, and one reason is that there is a lack of awareness. So I think what is very key is to conduct a comprehensive needs assessment. So the procedure to improve the procedures of needs assessment and to involve multidisciplinary teams in this assessment. Psychologists, education teachers, social workers, so very workers with very complementary skills to assess that. And then also setting adequate referral mechanisms are very much needed to ensure that families are aware of the services they can get at the time they need them. This is key, and this appears to be key in countries that are developing good practices in this area.
Great, thank you for that, Karen. Olivier. Conor O'Mahony, to bring you back in, I wonder, in everything we've talked about today, data, the case studies, policy formulation, interagency collaboration, everything, just is the voice of a child, the voice of parents, featuring enough in all of our considerations, even how we've done policy formulation over the last 19 months? Has that rung through enough? Do we need to even think a little bit differently how we do that in the future?
Well, I think when you look at the whole question of child participation in Ireland and the voice of the child, this is something I think as a basic principle, I think we are warming up to it as a country. We have had good national child participation strategies. There's a new one that was recently launched, which has a lot of positive features, and we are seeing examples on the ground of areas where child participation is being enhanced. So I mean, from my own work looking in child protection, we see, if you look at the work of HICWA and inspecting foster care placements, they've really improved the way in which children participate in those. There's legislation currently in draft form around improving child participation in court proceedings. So there's good initiatives there. But I guess at the same time, we're starting from a long way back, and there's a lot to do to really make child participation a kind of a standard integral feature of everything we do from a legal and policy perspective. And during COVID, the international evidence, and this again would capture the position in Ireland, the evidence was that, you know, when things get tough, as it were, in times of crisis, that all of a sudden child participation can become a nice to have rather than a must have. And that there were, you know, key moments during the crisis, and, you know, okay, acknowledging that it was a crisis situation, it was difficult to do absolutely everything. But the research very much is that if you ask children when it came to the big decisions that impacted on them around things like school closures or family contact or things like that, you know, the most detailed study available, which was covered 25,000 children across a range of countries, including Ireland, only 20% of the children in that study said that they felt their voices were properly heard. So I think there is that question of saying, okay, yes, we're committed to child participation. We all believe in that and we want to work towards it. But we have to remember that if we're committed to that, we need to be committed to it all the time, and not just when things are going well, but also and perhaps especially when things are more difficult.
Thank you for that, Conor, and I think that answers a question I saw come in from Katrina, so thank you for that. Conor, Ella, I might put this one to you, please. Why not prioritise the 4 key principles of effective service delivery? Availability, accessibility, acceptability, and he has in brackets service user wishes, and adaptability, and in brackets future-proof, thus empowering end users, children and families. Is that one you can take?
It is. Well,
Great.
it's one I simply fully agree with.
Yeah.
And I think that's important. What strikes me there is that it makes eminent sense, but it's informed by design principles. We need to look at what service has been provided to the end user from the start and work back from there. I think that's what works. This initiative tries to do. It tries to flatten any hierarchy, puts people on a continuum from policymaker, provider, practitioner to end user, and in an equal footing to try and share the best learning possible so we can improve our responses to the children and young people. So that's what works is. But I think it's critical that, again, this just isn't a good idea that resides in an initiative. This needs to be mainstreamed in how we do our business, how we do our policy, how we run our services, and how practitioners interact, because that's exactly where the outcomes happen for the end user, children, young people and their families.
Great. Anyone want to come in on that, on our panel? No? Okay, great. I'm going to go to our next question from our audience, and we've a few minutes left. Anyone who wants to get in some final questions on the speech bubble. I'm not sure who to address this to, so everyone maybe just give it a listen. It's relating to Jesh. So Siobhan asks, housing, and she has in brackets, hidden homeless examples, multiple generations living together in overcrowded conditions. So childcare, waiting lists for psychology and mental health services are main barriers for disadvantaged families in my school. They're at crisis point. Huge investment in government-led building and recruitment is needed immediately. Why is early intervention not an absolute priority? Anyone want to take that? Karen, you have a hands up there. And anyone else who wants to come in on this? Karen, go for it.
Well, look, I'd agree with Siobhan. It should be a priority. And for the families we work with, housing is probably the single most the biggest presenting issue, and it's very hard to cope when you're homeless and when your address is a hotel room. And I think she mentioned DESH as well, which is the educational disadvantage, but we know 50% of disadvantaged children are not in DESH schools. So some of the structures we have are just missing on a large scale, a lot of children, and housing is just going to impact children into decades to come. It's just a scandal, and we saw that recently with the ESRI and IREC research. It is absolutely scandalous. So thoroughly agree.
Conor, you want to come in there?
And you know, in addition to the moral case we mentioned earlier on, the idea that there's an economic case very often here as well. I mean, the thing about the housing crisis, which is one of the number one things that Ireland has been struggling with in recent years, this impacts on all sorts of other areas of children's well-being, be it education. It exposes children to greater child protection risks. You know, so there are huge knock-on consequences, and failing to invest in housing now is going to create increased demand for other services later on. So again, this makes out both the moral and the economic case for earlier intervention on that.
Olivier, you want to come in there quickly?
Yeah, very quickly, just to mention and to link back with the webinar you had yesterday, because I seem to recall that this point was mentioned by someone in the audience, and taking the example of Toronto, area where the doctors are enabled to mention that housing is a key issue for families, and to refer to some services needed. So it could be part of the prescription of doctor. So but it links to the issue that housing is a very big issue, and that we need to have all social workers working together and to go back to the idea of a multidisciplinary team involving housing also.
For that, Olivier. Before we wrap in a few minutes, did you want to come in there, Conor? Yeah?
Just briefly, because I think some of those questions are really interesting from that came in there. I think, and Conor mentioned it earlier, there are a range of, I suppose, from a policy perspective, we need to realise that young people don't grow up in the shadow of the Department of Children, Equality, Disability, Integration, Youth. They go to schools, the health service, etc. So the challenge back to us is to look at some of those enduring issues that cross-cut across departments and cause significant problems for children and their families. And Conor mentioned earlier on the National Review Panel, Helen Buckley chairs that, and also we have the Childcare Law Reporting Project from Carol Coulter. Those two reports will be coming out soon, and those issues are writ large in terms of mental health, in terms of disability, in terms of addiction, and to a lesser sense the interaction with youth justice. So they're definitely something we need to have a very strong focus on going forward in terms of the next iteration of Better Outcomes, Brighter Futures, in terms of cross-government engagement, because they're called enduring issues because they continue to endure, and they do have a compound effect because they do get worse for people and they do cause significant problems. So they're critical issues we need to address. The bigger macro ones on housing, I think the points are made already, yeah.
So two reports to watch out for. Before we wrap in a few moments, I'd like each of our speakers just to take 30 seconds, maybe with a final call to action or one tangible idea or what you feel is maybe a quick win or a big bet, that to leave us all with a little bit of positivity and a little bit of hopefulness before we close out. Maybe, Ciara, I'll go to you first if you don't mind.
I'd go back to the point about milestones and providing the right services at different milestones, both from a universal perspective, because it could be quite predictable. It's also non-stigmatizing why you're offering particular things at different stages. But also in response to COVID, I think it would be a useful frame to look at, because we know, so for someone who's age 6 to 7, what did they miss out on? What's the potential impact of that on a child at that stage in their life?
Thank you for that, Ciara. Karen?
Thanks. Yeah, I have three quick things, and one is policymakers need to use the evidence in order to mitigate disadvantage. There's evidence the height of me about what lone parents and their children need. It's not being used. We have to design with the service user at the centre, and that has to be done within departments and across departments, because it's bewildering for people out there trying to navigate it. And we also need to remember, whilst we need services, sometimes families just need more income to be able to feed their children.
Okay, thank you for that list of three. Conor O'Mahony, thank you.
I think if I was to finish with a call to action, I think that one of the big things I'd like to see is that things could happen more quickly. I think, I appreciate the job of policy formation and legislation is complicated by its nature. It is slow, but I think there are times where we have initiatives which simply take too long. Childhood is short. The children grow up very quickly. A year is a very long time in the life of a child. Sometimes seems like quite a short time in the life of professionals or government and so on. And I think I would like to see some of the things that need to happen, that need to get resources where they need to get to, or get initiatives where they need to get to, just be a bit more responsive. During COVID, we had that time pressure all the time. The things needed to happen now. We didn't have time to wait around, and COVID focused the mind on that. I'd like to see some of that same focusing of the mind maybe coming to seeing quicker and more timely rollout of initiatives rather than a more slow burn approach.
That, Conor, so continued sense of urgency. Olivier?
Yes, as a final point, so we discussed about investing in family support services, but we did not discuss that much about quality. And I think investing in quality is also important, because the area of family support services is populated by a variety of providers and services that may vary substantially in terms of quality. one aspect of quality is that it depends heavily on practitioners and on workers. So we need to equip them, to train them, and to keep their training also to adapt their practices and to help them adapt their practices to the context where they have to implement and to deliver their services. We have to help them also to cope with stress. Job turnover is very high in this area, so it's all part of quality. And then to link also to the point that was made by Karen, evaluation of outcome for children and families is also very, very important. And in the survey we conducted on family service providers, we realized that only half of service providers we interviewed are conducting outcome evaluations. So they are doing a lot of evaluations of on how they on their delivery process, but very little on outcome. And it's also very important.
Okay.
Quality and support.
Point well taken. Quality and supports. And lastly, to you, Conor.
Thanks. Just to endorse some of the points made in terms of Olivier, the quality piece is key. Just because the service exists doesn't mean it's quality service provision, and I think that's a kind of mature conversation we need to engage in, and I mean that throughout sectors. And I think quality we need to move away from seeing it as an industry kite mark, but something that's more kind of practitioner respectful, looks at practitioner wisdom and supports people's work in that regard, wherever they are, a policy maker, provider, etc. along that continuum. Conor's point around accelerated delivery, fully agree with that. I think we need to capitalise on that. That should not just be a kind of an interesting COVID blip. That should be something that we move on in terms of moving fast, moving together, and increasing responsiveness and reach. I think we do, on a kind of positive level, I do think we have some interesting initiatives coming together at the moment, cohering, such as the EU Child Guarantee, the implementation of that, developed a BOBF 2, which has started already in the department, the continuation of this What Works programme, and then critical organisational reforms such as the restructuring at TUSLA, huge improvements in the organisation there in terms of their work. So I think things are coming together really well. What I would like to see at a kind of bigger conversational level is, I think we talk about the impact of COVID. What's really struck me is what COVID has shown us, and some, not that we needed to know, was the imperative of care. I think care in terms of society, in terms of community, is central to really what we do, and I think that should be foregrounded and exhibited in the policies that we develop. So I think that's a critical piece. Yeah.
Okay. Well, on that, we'll leave it there for today. I hope for you, our audience, that was a really practical, inspiring hour for you, that you've come away with some functional takeaways and ideas. You will get a survey into your email in the coming minutes. We really would appreciate your feedback. Your feedback helps us inform the future webinars to come, and that we can tweak and make them better based on needs and what is resonating. So please do give us your feedback there. As we said, there are 2 webinars left in this series of 4, 2 next week. You can find out more and go and register on the whatworks.gov.ie/Festival of Learning 2021 website. Huge thanks to our speakers today, to Olivier Thévenon, Conor Rowley, Ciara Pigeon, Conor O'Mahony and Karen Kiernan. Thank you sincerely for your time, and to our Irish Sign Language interpreter Bernadette Ferguson for joining us here in studio as well. What Works, as we said at the beginning, is an initiative designed by the Department of Children, Equality, Disability, Integration and Youth, with funding from dormant accounts. The department worked with CES, Centre for Effective Services, in planning and delivering this series of webcasts. We look forward to seeing you back here next Monday at 2 o'clock. See you then, and have a great